So it's Timothy Brown, CEO of Roycorp here today, Canada dental practice appraiser and brokerage firm. I just did a film here with Dr. Alan Leko and Rod from Dental Rainmaker, and then we were just wrapping up, and another idea came up. So, Alan, you wanted to talk a little bit about clinical support for practitioners because you are a licensed practitioner and, in my opinion, an exceptional clinician. Tell us a little bit about what you can do on the clinical side. The last film was about business. Go ahead, Alan.
So basically what we want to do is merge the two. First, we want to start with obviously helping the business and doing analysis of that. But the second thing, which would kind of have us stand out, is basically I would also like to support people, support dentists in terms of, clinical decision making, looking at diagnoses, study models, treatment plans, having a support network, being somebody that you can call and say, hey, do you want to take a look at this? What are your thoughts? What are your opinions? I've been doing it for 17 years. As Tim knows, and he knows me as a clinician, I'm very straightforward. I'm a very preventative type of dentist. I'm very conservative. And I just feel like I never had that mentor. When I took over my practice, they sold me the practice and they were gone within a month, and I had to learn everything by myself. Obviously, I had certain friends and certain support networks that I could go to and ask. But to have someone there that will be there 24/7 to help you, and to just be there and support and give you guidance or even feedback or just even encouragement, I think that would be invaluable. And I wish I had that because I had to learn everything from scratch. So I want to provide that to other dentists and hopefully make their lives a little bit easier and get rid of some doubt, right?
I think a lot of we deal with a lot of younger dentists who purchased a practice, and clinically we're quite impotent at Roy Corporation. We're not involved in that. So, they always say, oh, I got classmates and I've got professors I can go to. All the dental reps have mentors within their reach that they can share because they're usually selling merchandise and, they want you to learn a certain procedure or technique to buy their goods and their wares. But yeah, I think that a lot of dentists are given opportunity to reach out, but I think very few do. I think you're in the midst of a day, you've got a patient in the chair, a patient in waiting, a hygienist tapping on your shoulder, you hear the phone ringing, and you don't have time to stop and reach because you're trying to pay the bills. You've got to pay the rent and the wages and the bank loan and the student loan, and you're pregnant with your second child, whatever. So I think that everybody says they're there for dentists, but I think dentists have a little bit of reservation and nervousness to actually reach out to someone who's not in full-time practice, which you are not. You're not a practice owner, which you are not. You're not on the payroll of any dental company or any endodontic supply or a composite or x-ray company. You're an independent. So I think that maybe you have something that's a little lower barrier of entry that they can reach to you. And you're just, I'm a dentist. I'm not practicing now for my personal reasons. You can disclose those to anybody when you're ready. But I think that everybody says we're there for you, but I don't think the dentists reach because everybody wants to sell them something or everybody wants to send them an invoice.
Well, see, I'm really not selling nothing other than just wanting to help and to give my time. I want to give back to the community. The dental community and the dental profession gave me so much, and I want to be there to help others. Like I said, I didn't have that mentor or somebody that was really close to me that I could reach out to, but I'd like to be there for someone. And I can be there whether or not you want to be me in clinic, if you want me to sit there with you, or if you want me to go through or schedule a certain time that you want me to come in, I can do that for you. I can make arrangements where we can just sit down when you have time, when your mind isn't overwhelmed, when you're not doing a million things in practice, and just go over certain things. And it could be during the day, could even, if you want a quick phone call in the nighttime, hey, what do you think of this? What about this situation? How would I treat this? Or how would you handle this approach, this patient? Because every patient is individual and unique. So that's something I think we can offer that's different, that's unique, and at the same time is convenient for practice owners that are doing a million things a day, and they just sometimes need someone to kind of provide a fresh perspective, a second set of eyes in terms of how they would approach a certain situation or scenario in the clinical setting.
You go. For the listeners and the viewers of this, you do need someone to go to. I've had mentors, Rod. I'm sure you've had mentors in your career. They're not, you need them. They're not always there 24 hours a day for you, but Alan is in a position that he can be there on a pretty readily available basis because he's not in active practice. He's not in ownership position. He did very well. I can't give you the numbers, but I can tell you he did very well with the practice he built and sold. So he's not under financial pressure. So he's not here to hard sell anybody anything. I vouch for your character, Alan. I vouch for your business acumen entirely. Clinically, I got a pretty good idea you're all right, although pretty hard for me to tell. I'm a lay guy, and Rod, you and I are a little bit impotent with knowing the clinical side, but Ladies and gentlemen, I think that you have somebody here and he's a resource, and it wouldn't hurt to reach out, maybe just have a little chat and see where it takes you. I'm Timothy Brown, the CEO of Roy Corp, Canada's dental practice appraiser and broker. Thank you, Dr. Alan Leko. You're a good man, and I hope that people reach out to you.
Thank you, Tim. I appreciate it. I appreciate everything you've done for me. And, you're amazing.
Thank you. And Rod, thanks for joining us on the second video. Not too much for you and I here, but I know you're there with the AI, the digital marketing's always in the background. Have a great day, guys. Thanks.
Thank you.